Are you constantly avoiding social situations and feeling inadequate in your relationships? You may be struggling with avoidant personality disorder. In this video, we will explore the symptoms and causes of this disorder, as well as treatment options and where to start on your journey to recovery. Don't let fear and insecurity control your life any longer. Let's begin the conversation about avoidant personality disorder today. Avoidant personality disorder, what is it? Avoidant personality disorder, AVPD, is a mental health condition characterized by a persistent pattern of feelings of inadequacy, extreme sensitivity to negative evaluation and rejection, and a strong avoidance of social interactions. People with AVPD may feel very self-conscious in social situations and fear being rejected or criticized. As a result, they may avoid close relationships and limit their social interactions. AVPD is a serious condition that can significantly impact a person's ability to function in daily life. But don't worry, with proper treatment and support, individuals with AVPD can learn to manage their symptoms and improve their quality of life. Causes and risk factors of AVPD. Now, you may be wondering about the real cause of this disorder. Unfortunately, the exact causes of avoidant personality disorder, AVPD, are not well understood. However, research suggests that a combination of genetic, environmental, and psychological factors may contribute to the development of the disorder. Some of the potential risk factors for AVPD include genetics. Studies have shown that AVPD may run in families, suggesting a genetic component to the disorder. Childhood experiences. People who experienced abuse, neglect, or other traumatic events during childhood may be at a higher risk of developing AVPD. Social and environmental factors. People who have been exposed to negative or rejecting social environments, such as bullying or rejection by peers, may be at a higher risk of developing AVPD. Brain chemistry. Research suggests that imbalances in certain chemicals in the brain, such as serotonin, may contribute to the development of AVPD. It's important to note that these factors may interact in complex ways and that not all individuals with the risk factors will develop AVPD and vice versa. Remember that AVPD is often comorbid, meaning it may co-occur with other mental disorders such as depression, anxiety disorders, or substance use disorders. Symptoms of AVPD. How do you know if you're having this disorder? Here are some of its symptoms, which typically begin in early childhood. A persistent feeling of inadequacy and self-doubt. Individuals with AVPD may have a constant sense of not being good enough, intelligent enough, or attractive enough. They may also doubt their own abilities and feel that they are not capable of achieving success. Extreme sensitivity to rejection or criticism. People with AVPD may be highly sensitive to negative feedback or rejection and may take even small criticisms or rejections very hard. They may also have an intense fear of being rejected or judged by others. Avoiding social interactions and activities. Due to their fear of rejection or embarrassment, individuals with AVPD may avoid social interactions and activities, such as parties, dating, or job interviews. Having few, if any, close relationships. People with AVPD may have difficulty forming close relationships due to their fear of rejection and feelings of inadequacy. They may also have a hard time trusting others and may prefer to be alone. Difficulty expressing oneself. Due to fear of criticism, individuals with AVPD may have a hard time expressing themselves, either verbally or in writing, due to fear of being criticized or rejected. Avoiding new and potentially rewarding experiences. Due to fear of failure, people with AVPD may avoid taking risks or trying new things due to fear of failure and rejection. This can limit their opportunities and prevent them from reaching their full potential. Having low self-esteem and persistent feelings of inferiority. People with AVPD may have low self-esteem and persistent feelings of inferiority. They may also have a strong desire to be liked and accepted by others, but feel unable to form close relationships. Experiencing intense anxiety in social situations. Due to their fear of rejection and feelings of inadequacy, people with AVPD may experience intense anxiety in social situations. It is important to note that these symptoms should be persistent and significantly impair the individual's ability to function in their daily life to be diagnosed with AVPD. Coping up with AVPD. Keep in mind that managing AVPD is a lifelong process and requires patience and persistence. If you think you are experiencing one, here are some ways that you can do to manage that disorder. 1. Seek professional help. It is important to seek the help of a mental health professional, such as a therapist or counselor, who can help you understand and manage your symptoms. A therapist or counselor can provide a safe and confidential space to discuss your feelings and concerns. They can also help you identify and change negative thought patterns and behaviors that may be contributing to your symptoms. They can also provide you with coping strategies and techniques to help you manage your symptoms. In some cases, a therapist or counselor may also recommend medication to help manage symptoms of AVPD, such as anxiety or depression. It's important to work closely with a mental health professional to determine the best course of treatment for you. 2. Learn relaxation techniques. Relaxation techniques such as deep breathing, yoga, or meditation can help reduce feelings of anxiety and stress. People with AVPD may experience high levels of anxiety and stress in social situations, which can make it difficult to manage their symptoms. Relaxation techniques can help to decrease feelings of anxiety and stress and can also improve overall emotional well-being. 3. Challenge negative thoughts. People with AVPD may have negative thoughts about themselves and their abilities. These thoughts may manifest as self-doubt, low self-esteem, and feelings of inadequacy. It is important to challenge these negative thoughts and try to replace them with positive and realistic thoughts. Keep in mind that challenging negative thoughts is a process, and it takes time and effort. Changing negative thoughts and beliefs that have been ingrained over time is not easy, but it can be done with patience and persistence. 4. Take small steps. Start with small steps to build your confidence and comfort in social situations. Gradually increase your exposure to social interactions and activities. Remember that you don't need to hide forever in your shell. During your next social interaction with someone, try to make eye contact with them. You can also start by saying hello to a neighbor whom you have never talked to, or you can just ignite a short conversation with a stranger. These ways will surely help you in coping up with AVPD. 5. Practice assertiveness. People with AVPD may have difficulty expressing themselves and may avoid confrontation. They may also have a hard time saying no or setting boundaries, which can lead to feeling taken advantage of or resentful. It is important to learn how to express your needs and wants assertively and to set boundaries in order to be able to have healthy relationships. 6. Educate yourself. Learn as much as you can about AVPD, its symptoms, and treatment options. This can help you better understand your condition and how to manage it. Education about AVPD can also help to reduce feelings of isolation and self-stigma. By doing the above-mentioned coping mechanisms, you'll be able to battle that social awkwardness that's penetrating your personality. AVPD versus shyness. Shyness and AVPD, or Avoidant Personality Disorder, are often confused with one another due to the similarities in their symptoms and presentation. However, there are distinct differences between the two, primarily in the severity of their symptoms and the duration of the disorder. At its core, shyness is a common trait that many people experience at some point in their life, especially during periods of social transition such as moving to a new city or starting a new job. For most people, it is usually a mild feeling of anxiety or nervousness when meeting new people or attending social events. These feelings tend to dissipate after some time as individuals become more familiar with their surroundings. On the other hand, AVPD is much more severe than shyness and can have long-term effects on an individual's functioning in daily life. Typically marked by strong feelings of fear and anxiety when encountering unfamiliar situations or meeting new people, those with AVPD may experience extreme paranoia, self-doubt, self-loathing, and social isolation. They may also exhibit signs of depression and difficulty developing meaningful relationships due to distrustful thoughts about others. This disorder requires professional help to address its serious implications on functioning in day-to-day life. In sum, While shyness is typically seen as a temporary feeling that passes over time with increasing familiarity with one's environment, AVPD is a much more serious disorder that requires professional treatment to be properly managed. Those experiencing shyness tend to feel uneasy around unfamiliar faces or situations, but can generally function normally within their given context, whereas those with AVPD usually suffer from far deeper levels of anxiety which can greatly impede progress in both personal and professional realms if left untreated for too long. Avoidant personality disorder can be a difficult condition to manage, but it doesn't have to control your life. With the right support and resources in place, you can learn how to cope with the symptoms and take back control of your life. Start by talking to a mental health professional who is experienced in treating personality disorders, or seek out online forums where people are sharing their stories about living with avoidant personality disorder. You may also want to look into joining a support group for individuals struggling with similar issues, as these communities provide an invaluable source of comfort and understanding. No matter what path you decide on, know that there is hope available if you reach out for help. Thanks for watching and spending time with our channel. I know that there may be a lot more of you who are suffering from AVPD. So help us reach out to them by simply subscribing and giving this video a thumbs up. How about you? Do you have experience with AVPD? Let us know your stories in the comments section below. Thanks again, and see you in our next videos.